as I said earlier on, Alzheimer's disease is a major type of all dementia, right? Let's go through the symptoms of Alzheimer's disease. In fact, the disease describing here is very similar in other forms of dementia. So keep in mind, those are the main symptoms of dementia. Number one is the memory failure. When you come to a patient with dementia, the very first symptoms they might be having is loss of memory, especially the short-term memory. What we mean by short-term memory is, the recent memory. Say what they have for the breakfast on the same day, they cannot reproduce it. Oh, they keep thinking, and they cannot tell you what they had in the morning. Or the day before, what did they do? Did they go out to have a walk? They cannot remember that. Okay, so we are talking about short-term memory, and that is the most common symptoms for dementia patients. Why is that? If you look at their brain, if you do an autopsy of those early dementia patients, you see there's a degeneration of the hippocampus area. As we mentioned in the photo, a few slides beforehand, and you can see there's an obvious shrinkage or degeneration of that hippocampus area. And the hippocampus area is responsible for our short-term memory. Okay, the next symptoms dementia patients may have is decline in their language. They might able to speak some full sentence, but sometimes they're not able to name an object. Okay, such as like a pen. They look at the pen, they can describe it, but they cannot name it. Oh, this is a pen. Okay, so they have difficulty to find words. And other symptoms such as decline in reasoning and the thinking skills. Before the dementia happened, they may have very good, very intelligent thinking. I have a very good example for you here. An old lady, actually, she used to be a good learner. When she looked at, those TV shows, how to cook like a great dish, and she had no problem to it. But recently, she said, oh, I cannot understand what they're saying on TV. Even I tape it, I look at it again, but I still don't get it. So, this particular lady have very obvious decline in their reasoning and thinking skills, okay? And some dementia patients have decline in the movement as well, especially patients with Parkinson's disease, and they also develop dementia. Those groups are very obvious decline in movement skills. And they tend to be more slow responsive, and some patients might even have personality changes. Some people may be very gentlemen in the past, but they become very bad temper, and they even, always have bad temper, impatient to anything, So some personality change may trigger the alarm that you have to look for dementia as well. Delusion and depressions, sometimes patients with moderate to advanced dementia, they may develop, depression and delusion because they think, they have a lot of limitation to do certain things. Sometimes they are very depressed because of that. Okay, some family members actually have a lot of concern about dementia. Say a daughter bring, her mom to my office, she concerned about her mom, having dementia. So I asked about the history, and I eventually find out her mom doesn't have dementia. She only has like normal aging. But how to differentiate the normal aging and the dementia sometimes can be difficult. And I create a table here to help you guys to learn about normal aging and dementia. On the left is normal aging, and on the right side of the table is dementia. The first one on the left forgets something but remembers later. Okay, let me quote an example, then you'll understand it better. Let's say an old lady, she goes out from her room to the kitchen, and she's trying to get a cup of water. So by the time she gets to the kitchen, she totally forgot about it. Oh, what am I doing here? I supposed to be in my room. And then she go back to her room, and then her spouse remind her, what's going on? You're supposed to get a glass of water. Why are you coming back without that? And then she remember, oh my goodness, I supposed to get a glass of water. She recall all the memory. She remember it later. So that may not be dementia, that may be just a normal aging. Okay, let's look at the table on the right. Maybe the same lady, she goes out for a glass of water and then she went back in. Her spouse, remind her, oh, you're supposed to get a glass of water. And then she said, no, I did not remember that. I'm not. Well, she even refused after people remind her. So this is something alarming. She might have dementia. Okay, so we have to differentiate normal aging and dementia. Sometimes it can be very difficult. Even doctors find it difficult too. So we have to get more information and see which category the patient falls into. Okay, let's talk about the different staging of dementia. And we have 3 different stages. Okay, the first stage is early dementia. Sometimes, patients with early dementia, they may not have any severe symptoms. The only symptoms they may have is like a memory impairment, especially the recent onset memory. Okay, as you see on the picture on the right side, the hippocampus area, which is the area responsible for like short-term memory. Okay, so for the early stage of dementia, people will have some degeneration of this particular area, and that mainly affect the recent memory. It takes about 3 to 4 years from the beginning of dementia to like middle stage of dementia. During this stage, the area got affected in the brain, not just the hippocampus, and it spread to other areas, such as the language area. So the patient might have difficulty in verbal expressions, and they may even have long-term memory impairments, okay? The patient might have not just degeneration of hippocampus, the degeneration might spread to other parts of the brain. They might become more slow in response, they might become more emotional, and sometimes they might even have some psychotic symptoms such as hallucinations, including the visual hallucinations or the hearing hallucinations. And a lot of time during the middle age of dementia, the patient might have some problem to differentiate whether it's a daytime or nighttime. They're so confused about the timing. That's why they might try to go out from their home during the middle of night. And a lot of them may get lost on the street. And as you can always notice, from the TV news, and they always say, oh, Mr. Jones, get lost, as reported by the family. If anyone noticed and any sign of Mr. Jones, please report it to the police. And a lot of people with dementia, they get lost on the street. I've experienced with one of my patients. He sneaked out from his home, in the middle of night. Actually, where he went to. He went all the way up to the freeway, and nobody knows how he get there. But he was found on the freeway. That's a very dangerous thing, And you might bump into like a car accident, or you might bump into like some really bad guys, and they might rob everything you have, and they might injure you on the street. So we have to make sure they have enough protections, especially the family members, have to really keep an eye on them like 24 hours a day, make sure they don't go out by themselves. From the beginning, all the way until the late stage of dementia, it takes about 8 to 10 years, but it varies, in different individuals. And by this time, basically the whole brain gets affected. And the patient might have very severe symptoms. They have very difficult on the speech. Whatever they say, the family members may not understand. And they can't recognize their spouse. They cannot recognize the rest of the family members, especially the grandkids. They always got their name wrong. And they might become incontinent. They have to wear diapers. And some of them might even have swallowing problems. That's why they have a lot of weight loss. And they have a lot of limitation on their ambulations, and they can't even walk, and they become like bedbound, and they sleep in bed most of the time. And some patients' family ask me, Dr. Chang, what are the leading cause of dementia? And most of the patients of dementia, they die of like infections, especially like a pneumonia or urinary tract infections, because they have inadequate nutrition, and their immune system is suppressed, and they lie in bed most of the time, so they are more prone to like a pneumonia. So that most likely is the leading cause of dementia. Okay, we're going to talk about the causes of dementia. And we feel very bad, even we have a very modern medicine nowadays, we don't even know the exact causes of dementia. But we found something very interesting in dementia patients. When we do like an autopsy of the brain of dementia patients, we found out there are two different kinds of protein that exist in majority of cases. And the number one is the beta amyloid proteins. The beta amyloid proteins, they tend to clump together and they tend to form like different plaques that can disrupt the nervous system and make the brain cells die prematurely. And the other protein, which is very common too, named as like a TAR protein, again, they form a lot of tangles. They tangles up, among the brain cells, and that actually, again, kill up a lot of brain cells, and that the patient end up with dementia. So those two proteins are very common in dementia patients. But unfortunately, we still don't have like a diagnostic method to detect them before they end up with like a very advanced dementia. We are working on it. A lot of research are doing it. Hopefully, we can finally get some kind of test. We can test out, the two proteins well before the patient develop dementia. That would be a really, really great achievement.
Thank you so much, Dr. Chang, for sharing this valuable information on the topic of dementia and also giving us some secret tips to prevent dementia as well. If you like this video, please share and like, and most importantly, subscribe our channel